Well, good morning. In this humble space, between a burger joint and a chiropractor, healthcare rhetoric meets the real world. We've heard a lot about the Affordable Care Act and what it's meant for the more than 200,000 people we signed up initially and tens of thousands since then who have benefited from it in King County. After 4 years, here's what we can say for sure. The new Health Insurance Enrollment Center, this one of just 2 full-service centers in the state, will help save lives. Because that's what health insurance does. It covers the cost of preventive medicine like immunizations. It helps people manage chronic conditions from diabetes to substance use. It gives children a better chance to begin their lives healthy and happy. The numbers in King County have been truly astonishing. More than 93% of working adults are now insured. And more than 98% of kids are now covered. But we still have work to do, especially here in South King County. Now, while the uninsured rate in King County for adults is 6.7%, which nationally is very good, the uninsured rate here in South King County is 15%. And that's why South County is a focus for us. Last year, King County was given a goal of reaching out to 500,000 people through the exchange. We helped enroll more than 11,000 people. And this year, we've been asked to assist 4,300 people, and we are determined to more than double that again this year. The experts who will work here every day, including on weekends and during the evenings, will help people get the policy that is right for them. Some may say, why should I bother if Trump keeps trying to torpedo the program? Well, if you sign up now, you will have guaranteed access to health care for all of next year. If you wait until past the end of the enrollment period on January 15th, you may have a tougher time. The administration is already trying to make it harder for people to enroll throughout the year. And the fact that the federal healthcare website is scheduled to be taken periodically offline for maintenance is surely just a coincidence. Our message today is simple. Get health insurance. Now is the time to do it, and we are here to make it easy. It's my pleasure to introduce the head of Public Health Seattle and King County, our Public Health Director, Patty Hayes.
Thanks, Dal. Welcome. Very excited to have you here as we open this storefront. You know, as a public health department, we've been advocates for universal health coverage for many, many years. We're concerned that folks without health insurance, they are not able to access care, and therefore they have poor health outcomes. And they need to get preventive care. Some of the most important pieces towards a healthy life is making sure you're getting those preventative visits and things, as Dow said, about immunizations. With that in mind, we have so much to celebrate. As Executive Constantine said, we've cut the number of uninsured in our county by more than half. We've been leaders in the country, and much credit goes to our navigators and our outreach partners in this work. The navigators have been the face of Washington Health Plan Finder, meeting with families and individuals in every town here in King County, every neighborhood across King County. Our navigators and partners help people understand their insurance options and pick a plan that best meets their budget and their needs. And a special thank you to our leader in this effort, Daphne Pye, who you will meet in just a minute. She manages our network. She's a certified navigator herself. Thank you to all the team from Public Health, and thank you to our partners, including HealthPoint, who's down here in this part of the county, as well as nearly 40 other nonprofit agencies that we work with. Our navigator are answering all the questions that everyone's got on their mind right now. Are plans still available? Are they affordable? Well, the answer is yes and yes. There are more than 20 different plans in King County, and they are affordable for the majority of people because most people who are getting insurance qualify for tax credits. Those tax credits offset most or even all of the premium increases that you have heard in the news. Now, I know that that can be confusing, and really, that's part of the message that we're here today to talk about. If you or someone you know needs insurance or isn't sure about renewing their insurance, don't give up. And don't listen to the national news about that, because here in the state of Washington and in King County, we have Washington Health Plan Finder. You can go on that and see what you qualify for. You can't know what it really costs until you enter your information and check, because it will help you see that relationship between the cost of the insurance and then the tax credits. Talk to a navigator or a broker and get some guidance. We're in Federal Way in South King County today because data tells us that the neighborhoods here that have the most uninsured people are where we need to focus. Daphne and her network are expanding the strategies here with our partners and making sure these areas get special access, special attentions, showing up where people are. Anyone who says the Affordable Care Act is failing has not been paying attention to King County. It's working here, and it will work even better if we continue to invest in what works. It's my pleasure now to introduce the CEO of HealthPoint, one of our strongest partners, and present here with us today, Tom Trumpeter. Thank you, Tom.
Thanks, Patty. Good morning. I'm Tom Trumpeter. I am the CEO at HealthPoint. We are a federally qualified community health center located in suburban King County, providing comprehensive primary medical, dental, behavioral health, and social services to 87,000 people every year. I'd like to underscore what you've heard from Dow and Patty. Health insurance improves health and saves lives. We have seen that in action since the enactment of the Affordable Care Act. The Affordable Care Act has made both private insurance and Apple Health Insurance more available to more people. The navigators who will work here and who will work very closely with HealthPoint and other providers know their stuff. They'll help people find the plan that is right for them. At HealthPoint, we've seen the Affordable Care Act in action, on the ground. With public health, we've secured great insurance for thousands of people. And it's amazing to see the improvements that that has brought, not just in healthcare, but in peace of mind. Because of the Affordable Care Act, we've seen many of our own patients have insurance for the first time. We've been able to increase the number of people that we take care of. And we've been able to create innovative partnerships with public health and others to provide better care to more people, not just in our clinics, which we've expanded, but also in other community settings so that we can provide care where it's needed and when it's needed. It's been our experience that many people aren't aware of what they're really eligible for. It's not uncommon for people to learn that they're eligible for better coverage at a lower cost than they imagined. And that's what this enrollment center is all about, making sure that people get the coverage and the care that they need. Insurance is complicated, more so than many have thought. And that's why we're here. The navigators who will work here are smart people with big hearts, and they are experts at helping people get through the complicated stuff and be on a healthy path. The time for all of us to act is now, during open enrollment. And this is a great place to do it. Thank you.
And now it's my pleasure to introduce our imaginative collaborative, awesome leader for this effort, Daphne Pye.
Thank you, Patty. Good morning. As Patty said, my name is Daphne Pye. I manage the Navigator program for King County. And one of the messages that we have to our residents of King County is that you can get health insurance, and help us help you find the plan that's going to work for you. Help us get you enrolled and stay insured. One of the really nice things about Health Plan Finder this year is the fact that there's a new tool called Smart Finder. Smart Finder is going to actually allow residents to enter personalized information, and their choices will then be narrowed and will hopefully find the best plan that's going to fit their needs. But if people are still confused, they don't understand their options, we do have certified navigators. And a certified navigator is someone that understands the system. And at this office here in Federal Way, we have navigators that are here to my right. They are certified navigators. That means these navigators have got enhanced training from the exchange to help people when they're having problems with their accounts. If they don't want to come here to our Federal Way storefront, as Tom said, the Health Point clinics, they have clinics in Federal Way, Bothell, Midway, Des Moines, and Redmond. They can help you. We also have our Neighbor Care. They're a partner within our network. Our network includes over 40-plus agencies. Neighbor Care has clinics throughout Seattle. We have Gay City. We have Country Doctor Carolyn Downs. We have Global to Local. We have network partners that can help people get enrolled. Our message is to get enrolled and stay enrolled. And we know that our residents are afraid. We know with all the negative press that is out there that people are afraid that their premiums are going to go up. They're not going to be able to afford it, that they're going to lose benefits. So before you allow that fear to paralyze you when you don't get health insurance, come to a navigator, come to this storefront. On our website, we have a list of other locations that people can go to get enrolled. We go out to the community and we help King County residents. This Saturday, we'll be in the Columbia City area. We'll have an event at Columbia Health Center. On the 8th, we're going to be in the Capitol Hill area. We'll be at Cafe Solstice. On the 11th of November, we're going to be at Leschi Elementary School within the central area of Seattle. And on 11/14, we're going to be at Starbucks on 23rd and Jackson. We go out to the community because we care about our residents and we want them to get insured. So my final message to the residents of King County, get enrolled. Compare coverage, get enrolled, stay enrolled. And please contact us if you are confused and you need help. Thank you.
Thank you, Daphne. I also wanted to make note of the fact that we're joined by some of our federal partners here today. We work with them throughout the year to support their efforts to keep affordable care for our residents. And from the office of Adam Smith, we have Savio Pham. Thank you for being here. And from the office of Senator Maria Cantwell, Dana Lurie. We really appreciate the work that we're able to do day by day, week by week with our federal partners. As you can see, we have remarkably committed staff and community partners. Our success in enrolling so many hundreds of thousands of people in healthcare is based in large part on the work of Daphne and her team in helping to create and foster these networks of community partners, not a top-down, single point of contact, government-only approach, but an all-hands approach where trusted community partners are helping enroll folks throughout King County. We want to make sure that we get as many people enrolled as possible because we know that just as with education and transportation and housing, access to health care is foundational to the ability of people in our community to succeed, to thrive, to fulfill their potential, and that is our goal. We'd be happy to take any questions you might have.
Now, is there still, can you explain, because there's confusion over the individual mandate as the administration, talks about what they're going to do with that or not. People are still going to be fined if they don't get health insurance, right?
And I'm going to allow our experts to answer the questions about this. Go ahead.
Yes, that is true. In fact, this year is the first year when people file in 2017, they're going to require them to submit proof that they have insurance. If they do not, those tax returns will be rejected. If someone submits their tax return and they show that they have proof of coverage, but they didn't have it for the amount of months to meet the mandate, they will be penalized. So the penalty is still in the law. That has not changed.
So what would you say to folks who, I know there's a lot of folks that are eligible for subsidies and tax credits. There's a lot of people that are in the middle income area that absolutely, I would be one of them. I plugged in my numbers. There's no possibility I could afford coverage as a single mom under these plans that are available. What do you say to those people? Because I would just say, forget it. I'm not going to get it. Find me.
So one of the things that we want to do first is the first thing we want to do is today was the first day that the new plans rolled out. So in King County, we have 4 insurance company 22 plans. So the first thing we're going to do is we are going to look at the plan options to see if there's options available. The second thing we're going to do, if there's no plans within health plan funding that are going to work for you, we're going to refer you to the brokers. Because one of the things that we've been able to do is form some really good relationship with brokers. And with having that relationship with brokers, we'll give customers other options. So we are going to do those two things because we are going to encourage folks is your health care comes first. We have to get you coverage. We got to get you a medical home. And so if we're not able to help you, we are going to refer to a broker and see if there are some additional insurance options through a broker.
Part of the concern is premium jumps. Those are happening no matter what, and we've been hearing, is it going to be 30, 20, 40, depending on all the different options. But regardless of what happens in DC, the numbers are still going up here. Can you talk about that and what premiums are going to be if people are staying with their plan?
So within the silver plan is where you're going to see the price increase because of the whole cost sharing issues and not seeing the reimbursement from the federal government. In the silver plan, if people choose a silver plan, they will see a price increase. However, most people in a silver plan also get a tax credit. And one of the things that I've seen on the Kaiser Foundation's website, they actually estimated what potential premium increases could look like. They gave an example of a 30-year-old male, income about $30,000 a year, non-smoker living in King County. Last year in 2017, his premium was about $201 a month with a $31 tax credit. For 2018, his tax credit jumped to $131, and his premium is now $207 a month. So if those trends stay, then we're really hoping that having those tax credit is going to mitigate the increases within that silver plan. There was no increase in the gold or bronze plans, but in the silver plan is where you see that increase.
How much of a percentage was that on average?
It's about a 30% average. About a 30% average is what we've seen. But again, remember that under the way they calculate tax credits are based upon the 2 lowest silver plans. So if the silver plans, if those premiums go up, the tax credit goes up. So that's why it's really hard to kind of articulate how much someone's going to have that increase on their coverage, is because we know in most cases the tax credit is also going to go up. And the tax credit is based upon their income. It's going to be based upon their income, the 2 low silver. So if the 2 low silvers go up, tax credits will go up.
Are there new tax credits for either bronze or gold?
Those they can still use it. So a client can choose to use their tax credit for gold or bronze. It's just within that silver. If they choose a silver plan is where they get the cost sharing reductions.
Are there others? Well, it's very interesting in here. We've set up to meet with clients. These folks will be available to answer any questions you might have individually. And I want to thank you again for being here to help spread the word. Health insurance is available. Get yourself and your family signed up. By signing up now, you will be guaranteed insurance throughout all of 2018. It is critical to our ability to succeed as a community and for you to succeed individually that you have this health insurance, and we are here to help you get it. Thank you so much.